Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies within the health sector. In this video, we'll be discussing the National Nutrition Policy 2016. The socioeconomic development of every nation is closely linked to the nutrition of its citizens. When children are poorly nourished, especially during the first 1,000 days from conception through to their second birthday, their cognitive and physical developments are compromised. They become more prone to illnesses and death, learning and future productivity is impaired, and they may not achieve their full potential. Malnutrition, therefore, is a major impediment to socioeconomic development. Ghana's nutrition situation has shown a general trend of improvement, as reflected in several indicators over the last few decades, demonstrated by declining rates of undernutrition among women and children, who constitute the most vulnerable groups. However, the observed improvements have occurred rather slowly and unequally across the population. Despite appreciable gains made in improvement in nutritional status of the Ghanaian population, malnutrition among all the different physiological groups remain a major challenge, with devastating consequences including stunted growth, mental impairment, poor health, low economic productivity, and mortality. The observed decline in infant mortality has been driven largely by the reduction in number of children dying after their first month of life, as evidenced by the postneonatal mortality rate reduction by 50% from 27 deaths per 1,000 live births to 13 per 1,000 live births. Undernutrition is associated with close to half of all 5 deaths, with stunting level remaining high at 18%, with large geographical disparities and stunting level in some regions and districts by 20%. There is slight increase in wasting levels of 7%, which is still above the WHA and SDG targets. Anemia in women of reproductive age, adolescent girls, and young children remain high, and there is increasing trend in prevalence of overweight and obesity across all age groups. Although skilled delivery has increased considerably, only 52% of newborn babies are put to the breast within 1 hour of delivery, and 57% are not exclusively breastfed for 6 months, as reported by the 2017 Multi-Indicator Cluster Survey. Additionally, as low as only 12% of children receive the recommended minimum acceptable diet. Among children between the ages of 12 to 23 months, 97% receive BCG vaccination at birth, but only 77% receive all the basic vaccinations which are due for infants by the first year of life. It is important that interventions focus on addressing the leading causes of child mortality and morbidity, which are mainly preventable causes: common childhood infectious diseases and malnutrition. The National Nutrition Policy is an overarching multi-sectoral framework for achieving optimal nutrition and reducing malnutrition among people living in Ghana. The policy represents both a commitment from and a guide for the government of Ghana and stakeholders in regards to plans and actions to ensure adequate nutrition and well-being in Ghana. The National Nutrition Policy is designed to provide a framework for relevant ministries to align their policies and programs to contribute to the reduction in undernutrition, guide the process of prioritizing nutrition challenges for action, provide the basis for selecting and implementing priority strategies for prevention and control of malnutrition. It also serves to facilitate mobilization of resources for nutrition programming and prioritize nutrition to generate interest and demand for adequate food and nutrition security among policymakers and Ghanaians. Causes of malnutrition in Ghana. The following highlights the major causes that contribute to the high and persistent rate of malnutrition in Ghana: disease burden and healthcare, dietary practices, food insecurity, food safety, water, sanitation and hygiene, caring practices and sociocultural factors. Existing nutrition strategies. Ghana's response to the previously mentioned nutrition issues employ a framework which highlights the necessity of implementing high-impact nutrition-specific and nutrition-sensitive strategies proposed by the Lancet series on maternal and child nutrition. The nutrition-specific strategies include policies and programs that address the immediate determinants of nutrition, such as feeding and care practices, management of severe malnutrition, micronutrient supplementation, and improving care practices to improved hygiene, water supply and sanitation, poverty reduction through microfinance, and sustaining livelihoods of ultra-poor households using cash transfers. Key gaps in the area of nutrition. Despite the implementation of the variety of strategies mentioned, the burden of malnutrition remains unacceptably high. Some of the gaps that need to be addressed include poor coordination and harmonization, limited integration of nutrition, inadequate understanding of the links between the various determinants of malnutrition, inadequate funding for nutrition programs, inadequate human capacity and governance, poor access to services, high rates of extreme poverty and illiteracy, inadequate monitoring and technical support, lack of clarity in roles and responsibilities, over-centralization in the health sector, inadequate information on nutritional status of school-age children and the elderly. If you've liked this video so far, give it a thumbs up and subscribe to the channel. Comment down below as well to let us know what you think, and click the card above to view the Policy Visibility Drive playlist. Scope of the National Nutrition Policy. The health sector is recognized as an important leader in the implementation of nutrition-specific interventions. In addition, the important contribution of key sectors such as agriculture, education, gender and social protection, local government, and water and sanitation, as well as civil society and the private sector, are considered essential to implementing nutrition-sensitive interventions that address the underlying causes of malnutrition. The policy shall thus be implemented across all relevant sectors and integrated into the plans and activities of all relevant MMDAs. Civil society and other non-governmental agencies whose activities span nutrition shall be encouraged to utilize the policy as a guide for all nutrition-related activities. Guiding principles. The successful implementation of the policy is based on the following guiding principles. Adequate nutrition is a universal human right. Effective intersectoral partnership and coordination. Nutrition is a priority human development issue. Gender considerations and the needs of all vulnerable groups are given special attention. Decentralization of resources and interventions. Community empowerment and participation. Evidence-based and effective intervention shall be implemented at scale. The goal of the National Nutrition Policy is to ensure optimal nutrition of all people living in Ghana throughout their life cycle. The objectives of the policy are to increase coverage of high-impact nutrition-specific interventions that ensure optimal nutrition of Ghanaians throughout their life cycle, with special reference to maternal health and child survival. To ensure high coverage of nutrition-sensitive interventions to address the underlying causes of malnutrition. To reposition nutrition as a priority multi-sectoral development issue in Ghana. Coordination and institutional arrangements for implementation of the National Nutrition Policy. The policy shall be implemented by various ministries and agencies. A strategy document shall be drawn up in line with the policy, identifying responsibility for each activity with a predetermined timeline for implementation and a means of verification. All activities in the strategy document shall be coordinated at the national and subnational levels as indicated in the M&E framework. At the national level, an effective institutional arrangement is necessary to ensure that result-oriented implementation of the NNP nutrition policies and programs require coordination across various MDAs, government institutions, adequate funding and comprehensive scope and coverage. The Ministry of Health shall strengthen human and institutional development capacity for nutrition and related services at all levels of the health system, provide technical support to other MDA for the implementation of nutrition-specific and nutrition-sensitive interventions of this policy, and provide oversight and guidance on norms and procedures for the prevention of malnutrition. At the regional and district levels, coordination shall take place through the existing decentralized structures of government and technical committees of relevant MDA. Research programs shall be designed in collaboration with findings that shall be disseminated in an appropriate format and timely manner to inform decision on policies, programs, and strategies. Research shall focus on local level investigation to guide the design of programs that address the unique conditions at the decentralized level. Communication. A communication and advocacy strategy shall be developed to address behavior change, to develop the knowledge needed by all individuals to make good decisions on consumption and child feeding practices, and to increase awareness and commitment to solving nutrition problems in Ghana. Effective and efficient implementation of the National Nutrition Policy depends on accurately tracking progress and performance, evaluating impact, and ensuring accountability at all operational levels. An M&E framework for the National Nutrition Plan shall be based on the National M&E system, which requires that all subnational levels develop M&E plans and reports for accountability, utilizing existing mechanisms for collecting routine programs and service data obtained from the Policy, Planning and Monitoring and Evaluation Directorate, the RPCUs and the DPCUs. Administrative data system shall be developed and complemented with data from nationwide surveys, such as the GDHS, MICS, the Ghana Living Standards Surveys, the Food Security Monitoring System, Nutrition Surveillance Surveys, and the National Comprehensive Food Security and Vulnerability Survey. This data shall then be used to identify malnutrition burden and distribution to guide investment plans, enhance the evaluation of existing interventions, and contribute to improved nutrition planning and programming. Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.